Now, despite the fact that I am strongly opposed to mandatory vaccinations, there can only be one almost rational and scientific reason for mandating vaccinations. That is, whether by not getting the vaccine, they will endanger the people around them. So in this video, we want to dig a little deeper into viral load and virus spread. Now, my name is Renwa and you're watching Health Informer. And I started this channel so that I can talk about things that you don't really see spoken about in the mainstream media or corporate media. At the start of the mass vaccination campaign, CDC Director Rochelle Walensky said that vaccinated people do not carry the virus. So to give full context, the whole statement that she made was, we can kind of almost see the end. We're vaccinating so very fast. Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but also in real world data. Now, an article titled, "It's Official, Vaccinated People Don't Transmit COVID-19" was writing about the statement, and it was later taken down by Fortune and redirected to another article to clarify her assertions. But it was never fact-checked after getting some pressure by different scientists and people out there in the field. So now many people adopted this talking point that the vaccinated cannot spread the virus, and some still do even to this day. And as a result of that sense of security, some may have let down their guard and been negligent with virus prevention measures. But the question that we need to ask or answer, do the vaccinated against COVID-19 have less viral load, and are they less likely to spread the virus to others? Basically, do the mandates have any scientific justification? Let's dive in. Now, before we get into some of the studies on viral load, I first want to define viral load and its role in the spread of the virus. So simply explained, viral load is the amount of virus in the body. The more the virus has replicated, the greater your viral load, and the more infectious you become. The more virus in your airways, the more virus you will expel when you exhale or cough, since you are experiencing more viral shedding. Now, as a result, those in close proximity may be exposed to a high enough viral dose to become infected. Now that we've gotten that out of the way, let's move on. Now, a preprint study published found no significant difference in viral load between the vaccinated and the unvaccinated, asymptomatic and symptomatic groups infected by SARS-CoV-2 Delta variant. Now, the study showed that there were no statistically significant differences in the mean CT values, that is a way of measuring how much virus you have, of the vaccinated versus the unvaccinated, the samples that they gathered. So now in both vaccinated and unvaccinated, there was great variation among individuals with CT values of less than 15 to more than 30 in both of the cases, the data that was shown. Now, and I have seen people argue before that though there are breakthrough cases, since there are more asymptomatic cases from the vaccinated, that they are less likely to spread the virus. However, surprisingly, the study also showed no statistically significant differences in the mean CT values of asymptomatic patients versus symptomatic samples that they had gathered. So now this analysis also found that 25% of vaccinated households contacts still contracted the disease from an index case, while 38% of those who hadn't had the shots became infected. So becoming infected, not having the shot, 38%, and those who had the shot was 25%. So that is kind of the difference that we see here between the vaccinated and the vaccinated when it comes to contracting the virus. Now, the study concluded that the mean viral load as measured by CT values were similar for large numbers of asymptomatic and symptomatic individuals infected with SARS-CoV-2 during the Delta surge, regardless of their vaccine status, age, or gender. So now, given that low CT values are indicative of high levels of virus, cultural positivity, and increased transmission, our detection of low CT values in asymptomatic fully vaccinated individuals is consistent with the potential for transmission from breakthrough infections prior to any emergence of symptoms. So basically, that is saying that even though you may be asymptomatic or you may not be as sick, you can still transmit the virus. So it says, continues to say, in our study, over 20% of positive vaccinated individuals had low CT values, a third of which were asymptomatic when tested. This highlights the need for additional studies of the immunologic status of such vaccine escapes and how infectious they are. If such individuals carry high loads of active virus, asymptomatic vaccinated individuals may increasingly contribute to the ongoing pandemic as the proportion of vaccinated individuals grows. And this is very important for us to highlight because we see here that though you are vaccinated and you may be asymptomatic, as some may argue, you can still spread the virus and you may be contributing to the spread of the virus, as highlighted by the authors of this study. They further stated while vaccination remains the best protection against becoming infected and severe disease, the data gathered in the study during the surge of the Delta variant strongly support the notion that neither vaccine status nor the presence of or absence of symptoms should influence the recommendation and implementation of good public health practices, including mask wearing, testing, social distancing, and other measures designed to mitigate the spread of SARS-CoV-2. Also, I would just put mandates in there as well. Now, according to a recent Lancet article, the vaccine's effect on reducing transmission in the context of Delta variant within households is minimal. Well, what about transmission in the real world? Outside of the confines of our homes, does COVID spread at a lower rate in countries with higher vaccination rates? So let's take a look at a real world study. Now, an article published in the European Journal of Epidemiology sought to find out the relationship between the percentage of the population fully vaccinated and new COVID 19 cases across 68 countries and across 2,947 counties within the United States. The findings were at the country level. There appears to be no discernible relationship between percentage of the population fully vaccinated and new COVID-19 cases in the last 7 days. 7 days here is referring to from August 26 to September 1st, 2021. It continues, in fact, the trend line suggests a marginally positive association such that countries with higher percentage of the population fully vaccinated have higher COVID-19 cases per 1 million people. Notably, Israel, with over 60% of the population fully vaccinated, had the highest COVID 19 cases per million in the last 7 days. That is the period that we discussed before. So across the US counties too, the median new COVID-19 cases per 100 people in the last 7 days is largely similar across the categories of percent population fully vaccinated. So notably, there is also substantial county variation in new COVID-19 cases within categories of percentage population fully vaccinated. There also appears to be no significant signaling of COVID-19 cases decreasing with higher percentages of the population fully vaccinated. So here over and over again. Let's go further. Of the top 5 counties that have the highest percentage of the population fully vaccinated, the U.S. Centers for Disease Control and Prevention identifies 4 of them as high transmission counties. And we have that in the counties in Georgia, Puerto Rico, and New Mexico. And those countries have above 90% of their population fully vaccinated, with all 3 being classified as high transmission. So since full immunity from the vaccine is believed to take about 2 weeks after the second dose, the study authors, they conducted the sensitivity analysis by using a 1-month lag on the percentage population by fully vaccinated for the countries and U.S. counties. So the above findings of no discernible association between COVID-19 cases and the levels of fully vaccinated was also observed when they considered a 1-month lag on the levels of fully vaccinated. And this is important here. Let's look at the summary. In summary, even as efforts should be made to encourage populations to get vaccinated, it should be done so with humility and respect. Stigmatizing populations can do more harm than good. Importantly, other pharmacological prevention efforts, the importance of basic public health hygiene with regards to maintaining safe distance or hand washing, promoting better frequent and cheaper forms of testing needs to be renewed in order to strike the balance of learning to live with COVID 19 in the same manner we continue to live with a 100-year-old later with various seasonal alterations of the 1918 influenza virus. Now that is a lot right there. So we see here by this study that they didn't find no discernible difference between the countries and the counties within the United States that were fully vaccinated and the unvaccinated as it pertains to COVID-19 cases. And actually they found just the opposite. They found that countries that were more highly vaccinated had higher cases of the COVID-19 virus. So then, now that we know this, Sarah, we know that we saw the previous study on viral load that the virus was just as likely to spread within households at the same rate as the vaccinated versus the fully vaccinated. And in real world data, that the virus seemed to be spread in countries that were highly vaccinated. Let's go further. Even the expert's tone has begun to change. On the 12th of November, Dr. Fauci told the New York Times podcast that the vaccines did not work as advertised and that the Americans are in danger due to their waning immunity. Fauci said, and I quote, "It's waning to the point that you're seeing more and more people getting breakthrough infections. And more of those people who are getting breakthrough infections are winding up in the hospital." Even Bill Gates, who have been one of the experts that we've been seeing online. Bill Gates also said in a recent interview with James Hunt, "We didn't have vaccines that block transmission. We got vaccines that help you with your health, but they only slightly reduce the transmission. So we need a new way of doing the vaccines." Also, Rochelle Walensky, the CDC director, in an interview on CNN stated, "Our vaccines are working exceptionally well. They continue to work well with Delta with regard to severe illness and death, but that they can't do anymore is prevent transmission." So we see all of this here, that the experts are beginning to change their tone and it's now stating that it does spread with the vaccinated. Now, every time that this is brought up, about the vaccinated still spreading the virus, there are arguments that people bring against that. And in response to the vaccine failure to prevent infection, I have seen some argue that the virus clears quicker in the vaccinated. Now, this is based on a study published by Harvard. According to the study, the virus cleared on an average of 2 days earlier for those who had been vaccinated, from 7.5 days to 5.5 days. Now, let's think about this logically. If you become ill with the virus, you are advised to quarantine yourself at home. And if you're isolated at home, do you really believe that 2 days will make a significant difference in the virus spread to other family members? Now, the study on the viral load that I mentioned before found no difference in viral spread between the unvaccinated and the vaccinated people. And real-world Israeli data also revealed that there was no correlation between countries with higher percentage of the fully vaccinated citizens and COVID cases. Now, another response to these findings that the vaccine does not prevent infection is that it reduces hospitalization and death. Now, I want to settle this once and for all. No one is denying that it does this. Should we, therefore, make it mandatory for individuals to take vitamin D, exercise, lose weight, and eat a plant-based diet at the risk of losing their jobs and the rights for participation in society? Because this all help to lower the risk of hospitalization and death, and fortunately without causing adverse events. Now, the point is that the vaccines protect those who receive them from serious illness and death, but they do not prevent the virus from spreading to others. And choosing not to be vaccinated is putting your own life at risk. The health risk to others is minimal. And besides all of this, we have completely ignored natural immunity, which we have discussed on this channel, and which has been shown from the Israeli study to be up to 13 times more protective than being fully vaccinated against infection. What about individuals' legitimate concerns about the adverse events people receive from the shots? Your odds of dying can be substantially reduced depending on your age, whether or not you have certain comorbidities, which I promise I'll discuss more in future videos on this channel. So why aren't people free to assess their own risk with their medical providers? So my question to you is, do you believe that we should be mandating something that is purely a personal choice, whether or not someone wants to put themselves at risk? Please share your thoughts in the comments below. I would love to hear more from you. Now, if you enjoy this video and you're looking for more informative videos on health and natural health, please feel free to subscribe and give a thumbs up. Have a blessed day.